Yeah, hi, this is part 2 of the basic skincare as I was saying earlier. So, continuing for just now, after moisturizing, you need like other steps. So, I'm moving on to like for people with problematic skin. If you have problematic skin, you need to treat the problem that is if you have acne, you need to use, of course, pimple creams. So, for over-the-counter, there are many over-the-counter pimple creams, but the one which I found is the most effective and recommended by my dermatologist is actually benzoyl peroxide, which you can find over-the-counter like in Guardian, Watsons and stuff. And what it does is it introduces oxygen into the pore. Okay, how a pimple forms is when the pore is actually blocked and bacteria multiplies inside the pore, and this bacteria actually hates oxygen. So what the benzoyl peroxide does, it introduces the oxygen into the pore, thus killing the bacteria and thus reducing the size of the pimple. That's what it does. And there are many brands of benzoyl peroxide. There's Neutogena and Oxy, and they work fine. But what you need to know is that there are many different concentrations of benzoyl peroxide. There are 2.5%. I believe the Neutogena on the spot is 2.5%, 5%, and 10%. To buy, it doesn't mean that the higher the concentration, the better. It actually works the same for all. So the best is to get a lower percentage, preferably a 2.5 or 5%. That is probably the best, because the concentration is higher, it gets drier, so it will dry out your skin. That's basically it. So as you know, drying out your skin is no good, especially when it actually causes flakes. No good at all. So get something that is on lower percent and it just works as well as a 10%. Just that it's just right. Yeah. So as I have noticed that some people are actually very allergic to benzoyl peroxide, and they will get itch, like allergic as in when they apply benzoyl peroxide, they will itch. Oh, I forgot another thing, that when you apply benzoyl peroxide, only dab it on areas that you need. Don't spread it all over your face, because benzoyl peroxide is quite drying, so you actually dry out your face, which is actually not good. Yeah. Okay. As I was saying earlier, that some people are allergic to benzoyl peroxide, so you can't use benzoyl peroxide, and you need another thing. And another thing that is good for pimples are tea tree oil. I have a bottle here, I'll show you. And basically, tea tree oil normally comes in something like that. And this is from the Body Shop. And this is what is good as, because tea tree oils are antibacterial. So yeah, it kills bacteria as well. Thus, it's anti-inflammation too. So it will also like reduce the inflammation, so make the pimple less red. Yeah. So this is a good thing about tea tree oils, and it's not drying at all. Yeah. So you can actually spread it all over your face to help treat and prevent pimples. Yes. And let's see. Yes, and this is actually from nature. So it's not chemical, it's pure natural stuff, so it's really good for the skin, unlike benzoyl peroxide, which is actually chemicals. Yeah. So tea tree oil for people who are allergic to benzoyl peroxide. And the only bad thing I can say about tea tree oil is that it is not, the effect is not as fast as benzoyl peroxide, so it will actually take longer to actually treat a pimple as compared to benzoyl peroxide. But you know, that's fine, just it takes a longer time. Okay. Actually no, that I used to have very bad acne, and now that I've cured, but my doctor is afraid that it will like come back, or supposedly I do have like probably like a few pimples here and there. I need to actually treat them. So one of the things that I use is benzoyl peroxide, but another thing which I use is diazepam tea topical solution. This is actually an antibiotic solution prescribed by my doctor. So I use this. If I have a pimple, I use this on one day, and another day I'll use this. So they alternate each other. And this is actually, as you know, antibiotics are antibacterial, so they kill bacteria, and antibiotics do have like anti-inflammation property, so it will help reduce the size and help reduce the redness of pimple. So yeah, it's actually good stuff. This is 1% diazepam tea, means it contains 1% clindamycin phosphate, which is the antibiotic. And this is as this is an antibiotic, you need to get it from a doctor. You can't buy it over the counter. So if you want this, you see a doctor to get it, because it's actually poison. Yeah, it's a medication, so you need to doctor for it. Another thing which my doctor gave me is retin A gel, which I used to use this every night, but over the years my skin got better. I started to use it alternate nights. This can only be used in the night, because this is very sensitive to the sun. So if you apply this in the morning, you go out, you get like sunburn, definitely, unless you put on sunblock. So yeah, this is the other thing that I use like alternate nights. And what this does is it exfoliates the skin. It does chemical exfoliation. So what you should know about the skin is there are actually 3 layers of the skin, and the top part of the skin is the one with the oldest skin cells. So as time goes by, the skin cells will they will be removed, and the newer skin cells will sort of be pushed to the surface of the skin. So what this does is it blocks off the upper part of the skin, or the old cells, so that the newer ones can actually come up. And at the same time, it helps prevent the formation of pimples by actually unclogging the pores. What this does is unclog the pores, because as the old cells die, the skin cells, the dead skin cells, can't be in the pore, thus clogging the pore. So this prevents pimples, and recently people have been using this as an anti-wrinkle cream. The cream form is used for anti-wrinkle because, as you know, wrinkles are formed because the skin starts to age. So this one actually helps promotes the increase of cell turnover. Thus, it helps prevent pimples as well as the newer skin cells are pushed to the surface. Yes, that's it. So yeah, use this only at night. Okay, moving on. Okay, for people who don't have acne, you can just skip all the pimple medications and just go directly right into applying sunblock after you apply your moisturizer. Yeah, as you know, sunblock is very important to help prevent the UV rays from attacking your skin. What UV rays does is it causes aging of the skin, and it causes sunburn, which will cause your skin to be very red and soft. Not good as well. And there are 2 types of UV rays. There are UVA and the UVB. UVB is the one that causes the burning of the skin, but UVA is the one that actually causes the aging of the skin. Not good as well. They are both bad, as you know. So you probably need to find a sunblock that that prevents UVA and UVB rays. So what I recommend is the A-beam emulsion in SPF 50. I know this probably is very high as an SPF, because if you don't do sports, probably SPF 15 or 20 is enough. But I do like more protection, so I use the A-beam emulsion SPF 50 plus. very high, but it does well. My skin has aged, so yeah.